Thank you, Acting President, and I'm really pleased to speak on this motion, and I thank Ms Maxwell for bringing it here. I will commit to speaking very briefly on this motion because I know it's Dr Q's smoko time very soon. But look, Australia was a leader in tobacco harm reduction, tobacco reduction. We were a leader in reducing people from smoking. We are no longer. We have stalled. And as a result of that, we are also losing control of the market. And as Ms Maxwell stated in her contribution, we are seeing that the illicit tobacco market is growing and organised crime is taking hold. In fact, just last night, there was a major bust up in my region, Reservoir, Campbellfield, all of those areas where 3 gang members were arrested. There was a huge haul of heroin along with a huge haul of illicit tobacco. So that is what we're seeing. It's very hard to value the illicit market. I know that Ms Maxwell has put a value going by the AMA's submission to the federal government, but I actually looked at this as well. The industry is worth, we spend about $14 billion a year on tobacco. There is an estimate that the illicit market is about 17% of the market. So that is actually $830 million. So you can see what a great incentive that is for organised crime when some of our poorest people are our biggest smokers. We know when we look at the statistics, it's not Kew and Toorak where we're seeing smoking. It's actually my electorate. It's Campbellfield. It's the lowest 5 SES areas where we see the highest level of smoking. The highest level of smoking is in our Indigenous population and in people who are unemployed. So the people who can least afford $48 for a packet of cigarettes are being charged that. And I looked it up, Dr Q. So it's the leading cause of preventable death. But what are we doing? We are pushing people into the illicit market. Now, I support Ms Maxwell's proposition for licensing, for that greater control of the market. I get that. But we have got to find the sweet spot. We have got to find the sweet spot in demand reduction, supply reduction, harm reduction, the way we treat all other drugs. And we're not doing that. So in the very brief moment, what I do want to talk about is that harm reduction, is that supply reduction. 1 in 4, and this was in the Australian Health Survey, 1 in 4 smokers said that price would not have an effect, or 1 in 4 said price would have an effect. 4 in 10 said that health impacts would have an effect. So the message is, and then 1 in 3 smokers said they did not want to give up. So if we want to reduce the illicit market, we need to reduce the demand for this product. It is harm reduction, it is drug policy 101. So how do we do that? Supply reduction. I would suggest let's look at harm minimisation. Let's look at something like vaping. That is something this government could do. This government has actually repeatedly prohibited vaping in Victoria. It is absolutely crazy. Here is we've got countries like the UK putting vapes on their PBS. They're actually paying for people to use vaporisers because they know that it reduces the tobacco market and saves lives. So I want to yet again repeat that vaping saves lives, that if this government was brave, if this government was serious about addressing the tobacco market, if it was serious about addressing the illicit tobacco market, by all means, license tobacconists, license people who are selling tobacco, try and reduce that. But when you've got a product that is so expensive and is so addictive, you have to deal with demand reduction and harm reduction. So I just yet again implore the government, in looking at addressing this really important issue that Ms Maxwell raises, I implore the government to reconsider their positions on nicotine replacement therapies such as vaping.